I was Katie's full-time carer due to some major physical chronic arthritis issues. So I gave up working, but there has always been issues with depression and anxiety. About 2 years ago, unfortunately, a family issue caused her to begin to buckle. And that came to a peak last year when she began to have what we loosely call a breakdown. She began self-harming and it became increasingly tough. The crisis team at that stage had already stepped in. And the most reassuring thing out of all of it was that they were able to reassure her that she was normal. We still have euphoric highs and we still have catastrophic lows. But we're able now to hear birds singing, see the sun shining, just look at life a little bit more positively than we used to. We have nothing but praise for the crisis team and the home treatment team. Whenever I wanted to, I could ring up, seek advice, get support, just reassurance that what I was doing was okay and that what Katie was doing was actually normal still and part of a bigger process. Some of the things that maybe didn't work quite as well actually had nothing to do with the crisis team and the home treatment team. It was more to do with the GP practice issue, where the solution seemed to be just keep giving medication, the same sort of medication, but up it, go and do counselling. The last time we saw the doctor before she had her breakdown, the doctor said, look, here's a number, I think you're going to need these. And it was the crisis team number. And true enough, I think it was about a week or so later, I had to call them and start that process, but then the whole thing kicked off and it was amazing. Rapid reaction, literally, it was like I rung up and I think it may have been the next day, I think someone came out straight away. And then there was this thing of, like, right, come and see us, we need to do this, we'll do this with you. So that's absolutely brilliant. But again, I don't want to sound like it's a criticism, it isn't, and I'm not picking on GPs because I know they have a lot to do. But there was a feel of abandonment, being left alone, to get on with things and just, it was saying, as I said earlier on, there was a thing about someone just contacting me and saying, are you okay? Are you coping? What can we do? Is there anything here at the practice that we can do to help you? And it was tough because I could see how much it was hurting Katie as well, because she was dealing with the physical pain, what she was doing to herself, the mental pain that she was going through. But there was also this element of being a burden. But I did feel very alone as a carer, even though the crisis team were brilliant in that they addressed Katie and I could always ring them up. There was always the feeling that I was having to be nurse, I was having to be friend, carer, support worker, counsellor, and actually I found it very difficult just to be husband and best friend. We now have a better balance. I wouldn't say it's perfect, but it's a much better balance, and we can now be husband and wife, we can now be the best friends that we've always been. But there is sometimes unfairly negativity around mental health crisis teams and care. But I know maybe we were fortunate, but the care that we got saved her. And so because of that, we should be eternally grateful. And there is nothing that we can do that will ever repay that.